I can speak from extended family experience, a different extended family experience about people who have pre-existing conditions, don't have a job, et cetera, who live in Massachusetts, that Romney Care adds value, and it adds value to people who are truly needy. There were something like 500 to 600,000 people uninsured in Massachusetts. Now, roughly 98% of the people are insured. But could you compare, maybe contrast, the Massachusetts plan to what has emerged from the Congress and the good parts, perhaps, of the current legislation, parts that you think in the fullness of time need to be changed and improved?
Yeah. Well, let me start off by just pointing out that I like the idea, and you quoting Jefferson, that the states are laboratories of democracy. I like the idea of letting states deal with issues on their own and fashioning their programs in a way that meets the needs of their own citizens.
Sure.
And I believe that as we do so, we can find what's good and bad in different ideas people come up with, and ultimately, perhaps, the states will adopt a similar program, or perhaps even the federal government will say, let's standardize this, we'll all do it together. So I begin by saying I like what we did in Massachusetts. It's not perfect. It's an advance, in my view, over what we had. But I wouldn't have taken what we did in Massachusetts had I been elected president and imposed it on the whole nation. And I said that time and again during my campaign. I would instead give the incentive for states to create their own plans, as we had, learning from ours. That being said, let me tell you how I looked at it from our state. You have three ways to deal with the healthcare system in our country for those that are uninsured. You have a lot of people that don't have insurance, and you can give them these options. One is to say, even though you don't have insurance, you can go to the hospital when you need emergency care or major medical treatment, heart attack, cancer, whatever. You can go to the hospital, even though you don't have insurance, and government will pay. That's one option. That's the option you have here, by the way. That's the option that most states have other than Massachusetts, which is somebody who is uninsured, who becomes violently, seriously ill, goes to the hospital, and you pay for it through taxes. Government pays. I didn't like that option. I call that the free rider option, which is I found that about half the people in our state that were doing that were making enough money to buy insurance, but they said, why buy insurance? If I get real sick, I can just go to the hospital and get free care. So, number one, we said we don't like that idea. Number two is to say, you know what? If you can afford insurance, you ought to buy insurance. And if you don't, we're going to create an incentive for you to do so. Now, the incentive we created was saying if you don't have insurance, even though you can afford it, we're going to increase your tax bill by about half the cost of the lowest priced health insurance plan available in our state. That was one way of doing it. Another way to do it, of course, would be to give everybody a check, except those that don't have insurance. Then they don't get a check, and that's the same thing, just in reverse. It's an incentive, if you will. It's called an individual mandate, but it says you have to get insurance to get that financial benefit from the tax man. The third option is to say to every employer, you must impose, or you must be given a mandate as an employer to insure all your people. The challenge with that one is you've got a lot of people that are unemployed or that are sole entrepreneurs, sole workers, and so that model doesn't work for a lot of folks, and so that one didn't work. So we looked at it, instead of the three, we like the one in the middle the best. We like the idea of creating an incentive for people to get insurance if they can afford it. And that's what we did, and that's what encouraged people to get insurance, and it's what allowed the insurance companies, the private insurance companies, to say, hey, now that everybody's in the pool, we can bring the premiums down. We don't have to worry about pre-existing conditions because everybody's in the pool. And we don't have to worry about people changing jobs and losing their insurance because, again, everybody's in the pool of insureds. So it works pretty well for us. Now, that sounds very similar to the president's plan, and in some respects it is. I don't know whether he looked at what we did or not, but he applied that same approach in the plan he put together. But there's some things I don't like about it. One, I don't like that it's a federal plan. I like a state approach better, because there are errors in our plan that ought to be ironed out and taken out. States could learn from one another. Number two, he raises taxes by $500 billion. He's putting a tax on capital gains, on dividends. That does not encourage investment and innovation. He's putting a tax on medical device companies, a lot of tax. That's going to raise the cost of health care in the country. I don't like that either. We didn't raise taxes, by the way. Our plan didn't cause a tax increase. Then he's cutting Medicare Advantage, $500 billion. I don't like that either. And finally, he's putting in place cost controls, price controls. He's given the federal government the authority to do a remarkable combination of things. One, he's going to let the federal government tell the insurance company what must be in their policies. And number two, he can set their price. So if he wants to, he can make them have product that's uneconomic, drive them out of business, and have government take over. That's frankly where I'm afraid we're headed, which is they'll put all sorts of mandated coverages in the insurance policies, raising the cost to the insurance companies. It'll raise their premiums a lot. There'll be an outrage. Oh, these companies are raising their premiums. We've got to get the government in to keep those costs down. And that's where I think the administration is headed. I can't prove that, but they say this bill is just the first step, and I think that those that are in favor of a single-payer system are planning on taking it in that direction. I think those of us who would rather keep a free market system, we're going to do our best to reverse that course.
It's a subject